Dear colleagues, dear audience, welcome to Interview with Masters series. In this series, we have a guest from Japan, Professor Takahiro Kinoshita. He is one of the most experienced surgeon in the world, I think, in terms of gastric cancer surgery. So I would like to say him welcome, and it's a pleasure for us to host him in Turkey and in our Congress. Welcome.
Thank you for having me today.
Thank you so much. I would like to say you, Kinoshita Sensei.
Yes,
Is it
please,
okay?
please. No
Thank you
problem.
so much. Kinoshita Sensei, we have some questions, and
Yes,
our
please.
surgeons and our young surgeons
Yeah.
very curious to hear your answers in some these questions. So the first one, what are the significant differences between the Eastern and Western approach in the surgical management of gastric cancer?
Okay. So East versus West, there are many differences, especially the patients are different, a little bit different. You know, the Western countries have more advanced stage cancer, yes, and more high BMI patient. Okay, so when we compare the East and West, there are many differences, especially patient is a difference. In Western countries, you have more advanced stage gastric cancer. And also you have more high BMI. The patient size is bigger. And another point is maybe Western countries, you have more proximally located gastric cancer near the EG junction. The technically more challenging cases you have. And thinking about the treatment strategy, the most different point is for locally advanced gastric cancer in Eastern countries, still surgery first, followed by adjuvant chemotherapy is a standard treatment. But in Western countries, before and after surgery, you give the standard treatment, FLOT, as a perioperative chemotherapy. This is a big difference. But in Eastern countries, it's now changing. We are now doing more and more neoadjuvant treatments. So I think the East and West are getting closer. And we have a more number of EGJ cancer because Helicobacter pylori infection rate is decreasing in Japan as well. So we have now more EGJ cancer and proximally located cancer. So we are getting closer now.
Yeah. Thank you so much. Actually, my second question was that can we say that they are getting closer, the East and West, and you said that they are getting closer. Thank you so much. The second one, that what are the criteria for success in stomach cancer surgery? It's important for the new surgeons, for the surgeons that interest in gastric cancer. So we are curious to hear your answer.
Okay. Okay. So generally, so gastric cancer surgery is thought to be very difficult procedures because anatomy is very complicated, and there is a pancreas. You should avoid damaging the pancreas, and you have many feeding artery to the stomach. So anatomy is very complicated. The most important point is know the anatomy, surgical anatomy, understand anatomy, and understand lymph node mapping, which area should be removed, and which is anatomical landmark for accurate lymph node dissection. This is the biggest point. Then the second one is when you perform, surgery for gastric cancer, the most important point is appropriate optimal dissection plane. So appropriate exposure of surgical field is very important. So if you perform laparoscopic surgery, you should collaborate with assistant surgeon or camera assistant to expose the anatomy. This is very important. If you perform robotic surgery, you should expose anatomy using robotic arms. This is a key point for the success of surgery.
Thank you. Thank you. And we are curious to hear the next answer. The importance of molecular and genetic guidance in gastric cancer surgery is increasing. What do you think about the future of this issue in Japan and around the world?
Yes, yes. In Japan now we have four key biomarkers to decide the optimal multidisciplinary treatment for the patient. One is HER2, second one is MSI, and third one is a CPS PD-L1, and fourth is Claudin 18.2. So, and maybe in the future more and more personalized precision medicine will be a standard treatment in Japan. And maybe in addition, maybe the technology of the ctDNA or liquid biopsy will be combined with a biomarker assessment and more accurate precision medicine and more accurate follow-up of the patient will be a standard treatment. And also, maybe surgical techniques, less invasive and function-preserving surgery using robotics or something will be a standard treatment. So it's the same between East and West.
So we will decide the surgery in terms of some genetic, and it will get more and more after that. The other issue is minimally invasive approach are increasingly gaining ground in gastric cancer surgery. When you look at the historical process, what kind of evolution do you foresee in the near future?
So personally, I think AI technology, artificial intelligence technology, will be combined with robotic technologies. For example, in Japan, already AI-supported surgery, navigation, real-time navigation during the surgery, maybe pancreas or nerve, or can be highlighted by deep learning AI machines, and which will be very helpful for the young surgeon or unexperienced surgeon to safely perform surgery. And the second attempt now going on in Japan is using AI technology. Maybe in the future, we can assess the surgical skill objectively. Using AI technologies. For example, your video will be assessed by AI machine, and your speed is 70 point, or your accuracy is 80 point. Or such a technology can be realized in the future, and more and safe and precise treatment can be provided to the patient. Personally, I think.
So can we say we are going to automatic surgery only made by robots in the future?
It's personally, I think automatic surgery is very difficult, because surgery is done not only the movement of hand, but our decision making. Decision making is complicatedly combined. So it is maybe far away, but I don't know.
We need some time, I think.
Yeah, we need still some time to realize automatic surgery. But AI-supported surgery, anatomical navigation, it's near this clinical use. Yeah.
Thank you. The other question is, how can international training programs play a role in standardizing gastric cancer surgery and management worldwide?
Yes.
Many young surgeons who follow us are curious about this. Could you say something about this, please?
Okay. So actually, in my hospital, always we have young surgeons from foreign countries. Yes. So they are very eager to learn the gastric cancer surgery or robotic surgery. And it is okay, on-site training. But in the future, maybe we can use, remote education or remote proctoring, or maybe we can use internet for give a discussion or giving a seminar, which will be very, very common in the future. And maybe this kind of education for standardization, equality can be realized in the future. Very, very efficient way, which will be very, very helpful for the patients all over the world, I think.
Yeah, I think so. So can we say these programs maybe in near future will make by internet
Yes, yes.
some maybe short,
Yes.
as you said, short meetings, short
Yeah.
operations to
Yeah.
see the show the operations to the international training programs.
Yes, yes.
Yeah, we can say that.
Yes, and so we can, shorten the learning curve. Yes, yes.
Shorten the
Yeah, shorten
learning
the
curve.
learning
Yes.
curve. Yes.
This is
That
the
we can
important
share
point.
the experiences. Yes.
So thank you so much for being with us,
Thank
and
you.
thank you for too much for watching to us. We will continue this series, and I wish to see you next sessions. Thank you so much.
Thank you very much.